We present a surgical video of a robotic-assisted Y-V plasty bladder neck reconstruction recorded at our institution. The case is a 53-year-old male who underwent a TURP at another hospital 2 months before coming to us. He complained of worsening urinary symptoms, mainly poor flow. Uroflowmetry confirmed obstruction, and cystoscopy showed a pinpoint stricture at the bladder neck. He was treated with endoscopic resection, but the stricture recurred. Since he also had a left lateral bladder diverticulum, we proposed robotic-assisted diverticulectomy with a Y-V plasty of the bladder neck. We used an intraperitoneal approach with a 6-port setup, including 4 robotic arms. The patient was placed in 25 degrees of Trendelenburg. At this point in the surgery, the bladder diverticulum had already been removed. We proceeded with dissection of the retzius space to identify the bladder neck after confirming the distance to the external sphincter by cystoscopy. We begin with a arciform incision of the anterior bladder wall. Once the stricture was located, we marked an inverted Y incision on the anterior bladder wall with monopolar scissors. This schematic explains the suture points used to create the Y-V plasty. Here we can review the inverted Y incision that was made. The V-flap was then advanced and sutured in place, completing the Y-V plasty and widening the bladder neck. The anastomosis is performed between the bladder neck and the urethra with a 3-0 V-lock suture in running fashion. The apex of the V was sutured to the distal urethrotomy with a 3-0 volts lock suture. We use a 22 FR Foley catheter as a guide, passing it in and out of the urethra to ensure patency. Here you can see the continuous closure of the double layer. Having completed the right side closure, we repeat the same 3-0 volts LOC running suture of the left side in a double layer fashion. We test our anastomosis with 250 cc's of sterile normal saline. This completes our bladder neck reconstruction. The postoperative period was uneventful, and the catheter removed 2 weeks after surgery. On follow-up, the patient has a good urinary flow and a wide bladder neck on cystoscopy. Thank you for watching.